Okay, I guess we're good to get started. Hello, everyone. I'm Aislinn Taylor from the California Telehealth Resource Center. Welcome, everybody, to the July 2021 presentation for the National Consortium of Telehealth Resource Centers webinar series. These webinars are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs. These webinars are presented on the third Thursday of every month. Next slide. Located throughout the country, there are 12 regional telehealth resource centers and 2 national telehealth resource centers. You'll see the CTRC in orange on the map. Each serve as a focal point for advancing the effective use of telehealth and supporting access to telehealth services in rural and underserved communities. Next slide. Just a few tips before we get started. As attendees, your audio has been muted for this session. Please utilize the Q&A function in Zoom to ask your questions. Questions will be answered at the end of the presentation. Please note that closed captions are available and it's located at the bottom of your screen. Today's webinar is being recorded and you'll be able to access today and past webinars on the NCTRC's YouTube channel. Next slide. Great, that's your cue. And today's webinar is being hosted by the California Telehealth Resource Center. See our logo up above me, and is being presented by the CEO of the Telehealth Certification Institute, and that's Mr. Raymond Barrett. Thank you so much for joining us, Ray. It's my pleasure to introduce you. Thank you for being here.
All right, excellent. Should I get started? Fantastic. Well, thank you very much for having me here. Really glad to be a part of this. And yes, my name's Ray Barrett. I'm the CEO of the Telehealth Certification Institute. I'm a licensed mental health counselor, and I love telehealth. When I first started my private practice, my first client wanted sessions over the phone. So I, right away started doing telehealth and had a little bit of a difficulty finding the answers to all my questions about telehealth. This is probably 18 years ago, but I dove in. So it's something that I got a lot of interest in and continue to work with. So at the Telehealth Certification Institute, we provide continuing education, training for staff, organizations, clinicians on telehealth, and also consultation. I'm really excited to present today because this is the first time that I'm presenting this course today. So it's the impact of technology on treatment. And what I mean by that is I think it's important to look at research when it comes to what are the differences between interacting with a patient, say through video, or when the clinician and the patient are in the same room as each other, or through text-based, or through an application, or just audio only. Like what are those subtle differences? And are they just as effective? When are they effective? When are they effective more than the others? And how is it that you decide what medium of communication to use with patients? I think that's really important to look at. And one of the things that I have found is that there's been some assumptions out there that have not been so helpful. So I think it's really good to actually look at the research. So I have a lot of research that I'd like to present today, and I'm certainly not going to have time to cover all of it. But we'll do the best that we can. So I'm going to take a look at the online disinhibition effect. You may have heard of that. And then how people self-disclose online versus on site, the impact of eye contact and being able to see each other's face, Proximix, how close we are to one another, video conferencing, phone calls or audio only, messaging, which would be text-based, using applications, extended reality, using patient portals, the impact of using different communication modalities on relationships, and then the benefits and drawbacks, potential benefits and drawbacks of using different telecommunication technology with patients, modifications for your treatment style and the techniques and the things that you do with patients, how to look at what modifications might be necessary, and then how to select telecommunication media when working with patients. Now that's a lot to cover, right? So I'm just going to be able to touch on these things with the time that we have. And I look forward to the discussion via Q&A at the end. So one thing I want to talk about is the online disinhibition effect. So you can see this guy here. He looks like he got a message that he's not so happy with, because people sometimes will say and behave in ways online that they would never do if they were in the same room as someone, right? So they might have side conversations while they're on an online meeting with you, right? They might be dressed in a way they wouldn't be dressed if they're going outside their home to a meeting. They might not be so nice, right? They might not consider you so much as, if they were on site with you. So now there's also some potential benefits of this, right? Some people might be more disclosing online, more vulnerable online. So there's potential benefits and drawbacks. So as a reference for this, John Soller, he explored this concept back in 2004, and he has an online book that has a lot of information on this. All right, so another thing I want to talk about is self-disclosure. So some people might fear being totally truthful and vulnerable when, say, doing like an intake survey or questionnaire or assessment when they're sitting, across the table from someone. So there's some research on this. So in 2003, there was a study that showed that people their willingness to answer extremely sensitive questions was highest for online surveys, right? Versus being in the same room as the person doing the assessment with them. And then in 2001, again, it showed that there was higher levels of disclosure for text-based surveys, again, versus being in the same room as someone. They also had a greater sense of private self-awareness. So they were more self-aware and less so aware of the other people that they're interacting with, okay? They were also on their online surveys, compared to having surveys when they're, with someone doing a survey with them in the same room. They tended to be more accurate with their answers. So again, this isn't, when we look at these studies, we're looking at the aggregate level. We're not looking at the individual level. So it differs from person to person. But what these studies show us is that maybe people will be more transparent and honest and accurate when doing surveys online. All right, next thing I want to look at is the impact of eye contact and seeing each other's face, right? Now, there's a lot of research here that I want to present. So the first one here is that when working with children, children had a greater rapport with adult testers who smiled more often, but who didn't have direct gaze, right? So when adults like looking right at a kid, right, they might get a little intimidated. But when they smile more, they have more, they have a stronger rapport. And there's more studies we'll look at in regards to that, the direct gaze. So also when children were face-to-face or even on video, they tended to avert their gaze away from the camera. And they think that might have to do because the overload of processing information when on video, that averting the gaze from the screen helps people think about the answers that they're wanting to share. So the other thing is, so that direct gaze during video meetings results in facial reactions indicating positive affect for the observer, right? And this is also shown when we have eye contact when we're face to face. But the thing is, they do not see these results with video recordings, right? So when we're on video with one another and we're making eye contact with the camera, people have a more positive experience with that than if I was looking away from the camera. But they don't find that case with a video recording, like if you were just watching this as a recording. All right. The other thing is, let me make sure I have all these studies up here, is the direct gaze during a video meeting results in facial reactions indicating positive affect in the observer, right? Yeah, so I'm sorry, I did cover all of them. Let me go to the next one here. In 2012, this study kind of proved the online disinhibition effect. Okay, let me explain the online disinhibition effect a little bit. So usually when we are in the same room as someone, we have some inhibition to be mean or to maybe share things that we might be embarrassed about, right? But when we're online, we have less of that inhibition to share these things. So this study in 2012, it showed that people are more threatening, aggressive when they're online than when they're in an on-site session. But it also shows that there was both more self-reported flaming, which is aggressive or insulting behavior, and threats, which was almost doubled when there was not eye contact during a video meeting compared to when there wasn't eye contact, right? So if people online, this study showed, if they didn't know who each other was online, they would be more aggressive. Not only that, even if they were online and they can see and hear each other, but they just simply didn't know each other's names, their identifying information, they'd be more aggressive. And then when on video, if they had eye contact with the camera, they would be less aggressive than as if they didn't, right? So it shows the impact of the online disinhibition effect. And then this study in 2005, what they had was they had one presenter and two listeners, and they had a shared conference room, and they wore headsets. And so with the headsets, it's basically looking at the screen, but in a headset, so you can't see anything else. So they're all sitting in the same conference room, but wearing headsets. And what they did is they made it look like the host was directly looking at both of the guests at the same time. So the host had direct eye contact consistently with both of the other people in the conference room. And that did not go well because the guest, they did not feel in tune with the host because they felt like it was unnatural, okay? So what we're learning here is that having eye contact with the camera is important for rapport and connection. But when it's just a direct gaze consistently all the time, it could come off as unnatural because sometimes people would naturally look down at their paper or look at something else in the room. So we don't necessarily have to have, consistent, constant direct eye contact. In this study in 2009, we compare video versus face-to-face communication. And with video meetings, people smiled more and they spoke louder than when they were on site with each other, and they had less touching of their face, right? Because this can be awkward having your hands in camera. People naturally know that. They smile more often. I wonder what that is. Maybe they're trying to connect through the screen. And they talk louder, okay? So people do tend to talk louder on video. And one thing to learn from that is you might naturally do that and you don't have to, right? We don't have to talk louder for people to hear us on video. Another thing is 2015, they wanted to look at does the mode of contact with different types of social relationships predict depression in older adults, okay? So what they found was that with older adults, if they had less contact with people on site, they had more of a probability of being depressed. But the thing is they did not show those results when it came to phone calls or, sending messages back and forth with writing. Okay. So it just shows that there's an importance, at least for older adults and depression, for people to have on-site relationships. Okay. And then in 2011, this has to do with our judgments of people compared to meeting with them through video or any computer mediated communication and face-to-face. So this showed that when participants communicated face-to-face, meaning in the same room as one another, they had more positive impressions of each other than communicating through instant messaging. Okay, so you're typing back and forth to each other. And there's another study that shows similar results to that in terms of our impression of one another face-to-face versus through computer mediated communication. All right, so in 2016, this was during interviews, right? And this is the other study that shows similar information here. So that when people had a job interview, they were rated higher when they had a face-to-face interview versus those who had interviews through the internet, like video conferencing. Okay, so video conferencing, they didn't get as good of ratings in their interview. Now, one thing I want to mention here before we move on is I consider that the results of these studies might be very different if we redo these studies, even 5 years from now, right? Because of people's comfort with technology, their experience with it, and the technology that's available. But these are the studies we have as of now, okay? So then in 2017, this has to do with getting people to do what you want them to do, right? Making requests online. So participants who made requests over email, they felt as confident as those who made requests face-to-face. However, the face-to-face requests were 34 times more effective than the requests done by email. Right? So if you're asking someone to do something, ask them to do it face-to-face, according to this study, is way more effective. All right. All right. And then in 2018, this has to do with our facial expressions. What do our facial expressions mean? Okay. This is important because, we hear about the importance of body language and communication, how much information it gives us. Well, what information does it really give us? So this study says that they think that maybe facial displays, they're not just simply readouts of what's going on internally with someone, such as their emotional state or their intentions, but it might have more to do with what they want to happen outside of them, right? So it might have more to do with social influence. So if I'm smiling, it might be because I want you to feel happy, right? And that's not necessarily that I feel happy. So that's something that I think ought to be studied even more. All right, so the impact of Proximix, like how close we are to one another. We all heard the power of presence. I worked as a hospital chaplain for 5 years, so I very much am aware of the power of presence and being a counselor, right? So when there's like a real crisis, I want to be there physically with someone because of the power of presence, right? But when you think of video conferencing, people are, their image anyway is like really close to you. Or when you're talking on the phone, you hold the phone right against your face. And then with the advancement of technology, I don't think it's going to be too far in the future where when we're on video conferencing, we're going to be seeing and experiencing each other in 3D, right? And be able to manipulate that experience. So things will certainly change. Hall in 1969, he looks at, what does social distance or Proximix mean about a relationship? So being 18 inches or less from someone, right, when you're next to them, is a very intimate space. I've heard one person say that when you're on video conferencing, like the screen's so close to you, it's like you're in the Proximix of either kissing someone or punching them, right? So when you think about that, like eating while you're on camera with someone, that's not cool because it'd be like eating when you're, foot and a half away from their face. It doesn't work so well. Okay. All right. So in 1998, this study showed that they did a simulation of a customer seeking financial advice from an advisor across video conferencing. Okay. And they had two situations. In video conferencing, the advisor was seated fairly far away from the camera. And then the other situation, they were seated like I am, close to the camera. And they showed that the customer was much more active, right? They were more interactive when the agent was close to the camera. So Proximix does matter. Now, you want to look at what you're doing with patients and all that kind of stuff. So I think it varies, and it doesn't have to be stagnant, right? So sometimes, say you're doing a physical therapy, OT or whatever, and you're demonstrating something. Maybe you're far away from the camera so they can get a full view, but then you might move closer at times, right, for that connection, okay? All right. So in 2020, we had this study that what they did is they looked at how people bridge the gap when they're, say, on a phone call or a video call. So on video calls, what this showed was that families, and it's a small study, right? What they showed is that some families would use humor during the video call, or they would do a virtual high five to bridge that gap and make that connection. So I know clinicians are doing things like that, right? They're using humor and body language and props and stuff like that to make that connection. All right, in 2001, this study showed that some patients appreciate the distance of video conferencing compared to face-to-face. I can't tell you the amount of times I've heard this from behavioral health professionals, right? Where clients feel safer. Why? Because you can't hurt them. Well, would a clinician hurt a client? No, but you can't hurt them when they're on video, physically anyway, right? So anyway, this study in 2001, again, this was a small study. It had 10 participants. But some of the things that they said was that it's sufficiently personal, okay, without being so personal as to be confrontational. There was good personal contact, but without the invasion of my space, okay? So some people appreciate that. And again, I think you have to look at the individual level. All right, so now we're going to talk about video conferencing. And I know we mentioned video conferencing a bit already when we look at, being able to see each other's face. All right, so in 2015, the findings of this, they generally show comparable treatment satisfaction as well as similar ratings of therapeutic alliance, okay? And this is comparing video versus being in the same room as one another for behavioral health, okay? All right. Let me see here. So, all right, so this study was in 2020. And this has to do with, what do people prefer? Do they prefer video, or do they prefer to be on site? All right, so the VA, right, the Veterans Administration in 2017, they provided tablets that were also had internet capability to many patients. And then they surveyed them. Would they prefer to meet with their clinician through video or on site? Or did they not have a preference? And the results was a third, a third, and a third. So a third of them said, hey, I want to do video sessions. A third of them said, I want to do same location. And a third of them said they did not have a preference, right? All right, so in 2017, this is the effect of screen-to-screen versus face-to-face consultations with doctors and patients, okay? And this is with simulated patients. So with respect to the patient-related outcomes of satisfaction, perceived information exchange, interpersonal relationship building, perceived shared decision-making, it showed no significant difference with all of those between face-to-face versus screen-to-screen, which would be video conferencing. Now, what's the impact of people looking at themselves on screens all day? You know, I say all day, you know, whatever. I don't know how long people are looking at themselves on screens with video conferencing, but what's the impact of that? Well, this study in 2021, it showed that since COVID-19 and people being on screens and seeing each other, there was a significant increase in cosmetic consultations because people were concerned about how they looked on camera. So there's some implications there. Like when you're on video conferencing, don't have it so that you can see yourself, right? You want to hide your own self view. I think that's good. And when you think about patients, right, they're going to be concerned about that. So you can mitigate those by the way that you configure the technology. All right, so now let's look at audio only calls. Okay, so one of the things they looked at here in this study in 2021 is whether or not people felt awkward. Okay, on audio calls versus text-based. And so what they did is they had people reconnect with an old friend over the phone or by email. And what it was is that people, they had a strong, they felt a strong connection, a stronger connection when connecting through phone, but they did not have any increase in awkwardness. But the participants thought that it would be more awkward to reconnect with a friend over the phone. So they would choose, okay, they would choose the text-based because of the, thinking that it would be awkward to talk over the phone, but they found out it wasn't more awkward, and they had a stronger bonding. All right, so 2017, I hear a lot of people say, especially in behavioral health, oh, phone sessions with clients, it's not as good as video conferencing or being on site because you need to be able to see the client. You're missing out on so much body language. Well, what do they mean there? I suspect what they mean is that I won't be able to really know what my client's feeling, right? If I can't see them, I need to be able to see them. Let's put it to the test, okay? So this study in 2017, that's what it looks at. They call it empathic accuracy. And what they showed was that providers actually were more accurate in terms of the client's emotional state over the phone than they were through video, right? And they think maybe the reason why that is because it already is difficult to really process and take in information through audio. When you add the video and the technology and so forth, when you add more, then it's even more difficult to assess those things. All right. So in this study, 1997, we're going to talk about phone skills, right? So what they did is they had clinicians respond to a crisis call, and they role played it, right? So these were simulated things. So the people playing the role of the client were asked, like, what was your perception of the clinician? Okay. And these were phone calls, like they were crisis phone calls. What they said was that the clinicians that were more verbally active, right? They took initiative in structuring the interview systematically. They explored all aspects of the problem. They addressed practical plus emotional concerns of the caller. They responded quickly. They spoke briefly, but often. And when they did speak, they used complete statements rather than yeah, right? They used complete statements like, oh, I hear what you're saying. Let me think about that, right? And when there were pauses, right? They didn't just let there be dead space. When there were silences, they would say things like, I'm just thinking about what you're saying, right? So that's something to consider when doing phone visits with clients. All right, a study in 2020 looking at phone versus face-to-face. Differences between psychotherapeutic, right, behavioral health encounters conducted face-to-face versus telephone. There's little differences between modes in terms of the therapeutic alliance, disclosure, empathy, attentiveness, or participation. Okay. All right. And then we have in 2006, we're going to look at satisfaction. Okay. This is interesting. So this was phone counseling. And with phone counseling, 96% of those that received phone counseling said they would receive counseling again. 63% of those that received face-to-face counseling said they would seek counseling again. We don't know why. Maybe it was the convenience. It doesn't mean one's better than the other, but they were satisfied with phone counseling. All right, now messaging, right? This is sending messages back and forth through text. So text-based electronic versus face-to-face communication. And this study was in 2020. And we're going to look at the effectiveness or versus the perceived effectiveness. Okay. So this had to do with, physicians communicating with their patients. Okay. And the physicians would communicate with their patients either through email, texting, or a client portal. Okay, that's the technology mediated, or they would communicate face to face with the patient. And then they wanted to see, was this communication effective? Well, what they showed was that the technology mediated versus the face to face, they were equally effective. Okay, however, patients preferred the face to face. They perceived it, right? They perceived that it would be more favorable, suitable, and a sufficient median in comparison to the technology based. Okay, so they perceived that it'd be better. In actuality, it was just as effective. So some of this has to do with training and preparing patients and clients and so forth, and educating them on these things, and people getting experience, I believe. All right, in 2018, this is looking at using text-based communication and also using smartphone applications in terms of the effectiveness, right? And it says that both mobile phone applications and text-based interventions increased adherence to medications and protocols and improved clinic attendance. Lower readmission rates and emergency room visits reported. Satisfaction with automated communication systems was high for both patients and physicians, right? And I know I'm not getting into the real details of these studies because for the sake of time, I have a lot I want to cover with you. All right, so then we have in 2022, this study looks at, do people prefer texting, video, or phone? Okay, and this, you can see this is between the provider and patient and primary care physicians. So this study was done in Canada, and at the time, it was the largest study that they knew of done on this between providers and patients in terms of their preference. This I found very interesting. So the patients had an option to choose to communicate with their physicians either through secure messaging, video, or audio. 82% of them chose secure messaging, 7 video, 11% audio. Now, so they really preferred the secure messaging, right? And what they said was that they preferred the convenience. They were able to respond when they wanted. They had more time to think about their questions and responses, and they also had a written record of the correspondence. One of the things they want to look at, though, is what was the impact of people's access to good internet and technology? Did that have an impact of why they were choosing that versus the video? Okay. All right, now we're going to look at text messages versus phone calls. And this study was in 2021. So a provider switched from providing next day post-surgery telephone calls to text messages. So after a patient would have surgery, the next day they would either call them or send a text message. And what they showed was that the use of the automated text message was associated with improved patient follow-up and nursing satisfaction, right? So it worked better for the patients and it was better for the nurses, right? And one of the reasons why it's better for the nurses is so easy just to send those automated text messages versus calling the patients, right? All right, so we want to look at engagement and self-management. This study in 2018 was a literature review of 93 studies, right? And it investigated medical compliance reminders. 93 of the studies looked at compliance reminders, right? And 56 studies investigated appointment reminders. Okay, so compliance reminders and appointment reminders through text. So it showed that nearly all those text reminders, studies. They helped improve patient medical compliance and helped with the appointments, right? People showing up to their appointments. And the reason why is because it was easy to use, it was inexpensive, and it was easy to implement and to deliver those messages to people versus the phone calls. All right, so then we have a study in 2020. And this was about 400 veterans with type 2 diabetes. And they were users of the secure messaging, right? And it says patients who received at least one proactive secure message from their clinical team were significantly more likely to engage in better diabetes self-management and report higher sense of diabetes self-efficacy, right? And they think the reason why that is, right? So if they received even just one secure message from their provider, right, the diabetes patients, right, they felt like they had better self-management and self-efficacy. And they attribute it to autonomy support is what they call it. Now, what they mean by perceived autonomy support is that patients perceived that their healthcare providers support their self-care choices and actions. So those secure messages, even getting one to the patients in the VA, showed that, hey, my provider really cares about me. And we're going to see more about that later. All right. And then in 2019, this has to do with motivation for using secure messaging. Are patients willing to actually use it, right? So patients' motivation will increase if it's easy to use and if they feel like they'll have direct access to their provider, right? Those things will increase, their use of it. However, if there's technology barriers, or if they're worried about their provider not being compensated for sending messages, or they're not sure what's appropriate for them to send, right? The messages for them to send to their provider, what's appropriate, what's not, that's going to decrease patients' motivation. So again, being really clear with patients what it's for. All right. So now in terms of applications, right? This is a booming market, as we know. In 2021 shows that mobile apps, and I think I might I'm going to summarize these results for apps. There's several studies for apps, and you can look at these, right? You have all these references if you download the PDF of the slides. There's several studies that show apps, mobile apps, are effective with patients. And some of them that have certainly shown effectiveness is helping people with anxiety. That's been shown to be quite effective. Now, one thing that does not show, you're like, okay, well, what's not effective? Well, as of now, anyway, one thing that does not show significant effectiveness is using chatbots. Now, that very well may change, right? This is all new technology. A chatbot is basically a computer that you interact with. You're communicating back and forth with a computer. That's a chatbot. And so as of now, anyway, though there's not real significant statistical significance in the effectiveness of those. But again, that very well may change. But with the applications, right, we're using an automated program application for, say, mindfulness, stress relief, CBT, therapy, pain management, those kind of things, that has been shown to be effective. All right, another thing that I don't have time to get into the details of this, but extended reality, right? You may have heard virtual reality, right? You wear the goggles. This technology is significantly improving. And this has been utilized for a fair amount of things. So virtual reality has been found to be effective. And there's not a study out there that I can find anyway that shows that it's not effective. and it's been used for pain, for anxiety, for neurodevelopmental disorders, for other mental health disorders. So the virtual reality, again, I think is something that we're going to be seeing a lot more of. All right, so the next thing is patient portals. So interacting with patients through patient portals. And this study in 2019. So what they say here is that the studies are still, immature. We still need more studies on this. Again, this is something that everyone is new to, but they have shown a benefit in the discovery of medical errors, improving adherence to medications, improving the communication between the provider and the patient. So there is definitely studies that show the significance there. I don't have time to go through the impact of using technology-based communication on relationships, but you have references here to that. Because what I want to do now is I want to take an overview look at the potential benefits and drawbacks of the different types of communication that we can use with patients. So if we look at text-based communication, right? So some of the potential benefits is that patients can have the time that they need to think about what they want to compose, to look at your answer, right? You know how many times patients come in, they forget to ask the questions that they had, right? So they have time, they have a record of the correspondence, right? Some people process the information better through text. Some people feel more safe through text than they do through audio or video. But one of the potential drawbacks is there is a study that shows that text messages are typically more misunderstood, right? So it's actually a study that shows that when people send messages by text, they think that they are going to be interpreted just as well as when they send, say, a voicemail. But the fact is they're not. They're more likely to be misunderstood through text. That's why it's important that when we send messages to reread it like the person that's going to be receiving it to make sure it makes sense. Now, in terms of suicide prevention, some organizations are sending what they call caring contacts. So after someone's admitted or treated for suicidality, receiving encouraging notes or messages by text, it has a significant impact on preventing suicides, right? Now, I remember going back to the other study we looked at in terms of receiving, the veterans receiving even just one message. It gives them the implication that, yeah, my provider cares about me, right? Now, in terms of audio only, some people, they process information better over the phone. That's how they do it, right? Sometimes they find the video or technology too distracting. Okay. Now, video calls, right? Some people really rely on the video cues, the visual cues, right? That's how they communicate best. And that's, so everyone has their own communication preferences, which changes moment to moment and according to the situation and their goal and the context, right? All right. So again, for sake of time, here are the references to that information. And now, in terms of the treatment that you provide, the services that you provide, and how it is that you provide it, the techniques, the interventions, and so forth that you do, what I recommend is that you take a look, you make a list on a spreadsheet. What are the interventions that you do? What is it that you need for those to work well? How do you do it with a patient on site? And then, are there potential benefits, drawbacks, to converting that to an online environment? And then what modifications do you need to make? So do that intentionally as a practice. So I'm going to give you an example. So this is an example looking at psychotherapy, and specifically the psychotherapy style of person-centered therapy, okay? So looking at person-centered therapy, how does it work? What does the clinician do on site? So we list that on the left-hand column. And the middle column, are there potential drawbacks or potential benefits, right? And then looking at the right column, modifications. If there are potential drawbacks, how can we either eliminate those, mitigate them, or convert them into a benefit, right? Okay. So now we'll just take a look at an example of selecting a communication medium, say for telemental health sessions. And some of this is a fit for any type of healthcare practice. Number one is, what is the provider, you, willing to provide? Are you willing to provide services through text, video, audio, right? Virtual reality, applications, right? What are you willing to provide? Then, what is the patient wanting? What do they prefer? Okay, that's very important. Treatment only works if it takes place, correct? So that's very important. And then you want to assess, knowing what you know, looking at the research, what might be the best fit for the patient at that time, according to what their needs are, right? And then you want to talk to the patient about that, okay? And invite them to those mediums of communication for those things and getting them using them, hand-holding them to get them started using those so they get comfortable with it. And then you could look at sequences or combining different mediums of communication for the treatment that you provide for your patients, okay? Because they all have a benefit, right? So some final thoughts I want to talk to you about is, one thing is, I find that providers, regulators, a lot of people, myself, right? Myself, a lot of us tend to make assumptions about these things. So one thing I recommend is to test out the assumptions. Like, I can't tell you how many times I've heard in behavioral health how the preferred treatment method is same location, right? I call it same location. Some people go face-to-face, in person, whatever. I'm like, why is that preferred? Like, really? Like, let's test that, okay? Maybe for some people, sure. All right, and then technology is changing. So look, the studies might have to be performed again. They might have a different result, and there's a lot of studies that still need to be done. And then what is the goal or task that you have for the patient, right? Is it an appointment reminder? Is it a follow-up treatment? Is it engagement? Is it, right? So what is the goal that's going to have an impact? What is the client preferences? And then really utilize surveys and data. So really utilize your patient portals, your EHR systems, all those things to gather data so that you can take a look at your customer base, your patient base, and what works and what doesn't, what the preferences are, et cetera. And again, these things will evolve, all right? And give people options of what they can use. And then training. If clinicians, if the staff are not comfortable with these technologies, if they don't understand the benefit, if they don't know any of the research, and if the patients don't, then it's not going to work well, right? So education and training. That's one of the things we're here for. We're a training institute. If your staff needs any training, if you need consultation, that's what we're here for. We're glad to help you with that. So some final resources. We are here for staff training, consultation. We have several courses. We're a CE marketplace. We specialize in telehealth, and we're available by phone, chat, email, text, etc. So please reach out to us. We'd love to talk to you. And there is our contact information at the Telehealth Certification Institute. So I want to leave time for Q&A. And I guess you're going to present the Q&A to me?
Yeah, so we'll just, if anybody has any more questions, please, now is the time to enter those into the Q&A box at the bottom of your screen. So we do have a few. One that came in the chat is, Is there a summary that can be shared with us of key suggestions and recommendations derived from a review of all of these studies?
I don't have that at this time, and to tell you the truth, I thought about this a lot. It'd be difficult to give like recommendations for like just general recommendations,
Mhm.
because it really depends upon what are you providing, what are all the different things you're providing. So like we went over in the end, at the end, that last second to last slide, what's your population, what are the tasks, what are the goals, what are their preferences, all those things. So it's really taking a look at the specifics of your organization and the service that you're providing, to come up with a real recommendation there.
Yeah, I agree, definitely. Real quick, I just want to jump in and see, because I see a few questions asking about a copy of the presentation and the slides. They will be available. We've linked it in the Q&A on the National Consortium website, both the recording and the slides from today. Okay, one more question. Other than the obvious benefit of becoming better at providing telehealth services, are there other benefits to becoming certified?
Yeah, in terms of certified, so credentials, right? Professional credentials. One of the benefits there is if you take a credentialing course, now it depends on which course you take, what program you take, but like we provide a telemental health training certificate program, right? And what that does is it covers comprehensively all of the essential aspects or competencies of telemental health. So by like taking our certificate program, you will know that you're getting training on all of those essential competencies, and it's kept up to date, right? So that's one of the benefits, rather than just kind of piecemealing taking courses. We as experts, right? This is what I do all day for the past 20 years. We know what competencies, based upon research and data and talking to experts, what competencies are really important to know today, right? So we really make sure to keep that up to date and comprehensive, what people need. So that's one of the benefits. Another benefit of just having a professional credential is so that other people are able to assess whether or not the clinician's likely to be competent in that area. So like licensure, that's what licensure does. One of the things is it allows people to know, hey, is this person likely to be competent in that area? So when you work in a specialty area, yeah, it gives people some assurance that, hey, you've had adequate training, you've been tested on this.
Great. I'm seeing, do you expect to see any changes in behavior post-pandemic as people were forced to become more familiar and comfortable with video tools? I know you kind of touched on that in the presentation.
Mm-hmm.
Yeah.
Yeah, I think so. It seems like, with COVID-19, everyone had to use telehealth. It's tapered off, but it's not down to where it was.
Mhm.
So yeah, I think it will, there will be more people now versus pre-pandemic. And I think that will increase, just like technology use is increasing greatly. I know someone that just got a job recently, and she said, I don't know about this because I'm a paper person and there's no paper in this office. So like she's thrown off, she's kind of new to the workforce.
Yeah.
So yeah, like I think the technology is improving so greatly and so fastly. It's amazing that people are going to enjoy it and like it more and more, because that's what the technology providers do. They're like, how can we make this so people love it? Okay. Yeah. So I think it's only going to get more and more so.
Agreed. Next one, when you say chatbots have not been shown to be effective, can you be more specific in the context and purposes? For example, this asker is saying that they've seen research showing that they are more effective than asking patients to fill out questionnaires.
Oh, well, in that case, that might be like filling out a questionnaire. Like when I say chatbots being effective, I mean for treatment itself is what I was looking at there. But chatbots are helpful in terms of people getting their questions answered. like there's chatbots on websites. So let's say I go to a website and I have a question, I could type in the chatbot. It's going to give me an answer. It's going to give me like, it's almost like a tree diagram for getting the answers and answers to the questions I have, or doing a survey. That makes sense. What I was, the studies that I looked at had to do with actual treatment,
Mhm.
like the chatbots, the therapist.
Yeah. Okay.
Yeah. So as of now, as of the research that I'm able to find on that, chatbots have not been shown to be significantly, statistically significant in terms of effectiveness with that. Now, again, these things are, they're improving very quickly with AI.
Mhm.
So again, we're at like infancy stages with this. But as of now, for treatment, I haven't found studies that show that it's effective. But yeah, that makes sense with questionnaires or with finding answers that they're good at doing that. Not that I prefer them. I prefer to talk to a person myself rather than have
Agreed.
a chatbot because they're limited. They don't always know what I'm asking. But yeah, they are helpful.
Great. Next question. The benefit for telehealth utility survey completed by patients and clinicians.
Repeat that one more time.
They're asking about the benefit of telehealth utility surveys completed by patients and clinicians.
Yeah. So yeah, I think that's you want to know what's working well and what's not for both the client. I don't know exactly what they're asking there, but you want to know what's working well and what's not for both the client and the clinician.
Yeah.
You want your clinicians happy. You want them, right? Because they might need more training, experience, whatever it is. You might need modifications with your technology. Same thing with your clients. Very important. So you want to respond to the needs and preferences of both. And the only way you're going to really know that is by having those surveys.
I agree. It's always good to get more feedback.
Mm-hmm.
So, are you aware of any differences in the telehealth modalities across different cultural and racial groups?
There are some differences. One of the courses that we provide is a course on engagement in telehealth. Another course that we provide is cultural competence and the use of telehealth. So a lot of minority groups in the United States have not used telehealth as much as the majority. And then we have to look at access and digital literacy. So some of these things people don't have access to technology or are not comfortable with it or don't trust it, or they don't trust that their needs are going to be met through telehealth as they would have been on site. Language barriers, they might not feel like that's going to be met as well online. So so there are some cultural differences there. And going back to the surveys, that's one of the reasons why it's really important to do the surveys and for the technology to be adapted to the culture of the client. I hope that we get to a point where the technology is adapted to the individual. If you go to Amazon or Google or whatever, their AI is constantly trying to adapt to you specifically, right? So there's a lot of ethics involved there and who's developing the technology and so forth. So we do have courses on that, but yeah, that is something very important to take a look at.
So I know we're getting close on time. There are a few questions that I don't know if we'll be able to answer live, but I know Ray's shared his contact information. We'll do one more. I would imagine personality makes a big difference as to how naturally people take to this. In your view, how much of these skills are inborn versus developed?
I strongly believe it's not about personality, I would say. I mean, I might be wrong on that, but I think it has much more to do with just getting comfortable and experience with using the technology by someone that helps you get comfortable with it. So I say that as someone, I mean, we trained, 26,000 clinicians. I mean, I trained
Mhm.
a lot of clinicians. And there's a difference between taking training online versus taking a live webinar where you actually experience these things, practice them, and get feedback. So being handheld to set up your environment, your camera, your audio, et cetera, so that you're able to present well and see well and hear well, all those things. I think it's a matter of getting the help to get the tech set up right and knowing how to use it. Yeah, and people adapt well. Some people take a little more hand-holding, a little more assistance than others. Yeah.
Yeah, I agree. Practice makes perfect. You just keep trying. One day you'll get kind of comfortable with it.
Yeah.
All right. We want to bring up those last slides, Aria. So just real fast, I want to say thank you to Ray for joining us today. It was a great presentation, lots of great information. And we hope everybody today will join us for the next NCTRC webinar. That'll be August 19th in the series. So yeah, it will be hosted by the Mid-Atlantic Telehealth Resource Center and will be on Delaware Libraries, Telehealth, and Teleservices Initiative. So registration will be sent out soon. Thank you everybody for joining us, and thank you again, Ray, for a great presentation.
Thank
And
you.
please complete your satisfaction surveys, everybody. They're super important to us. Thank you.